Good morning, ladies and gentlemen. The Committee on General Government Operations, Appropriation, and Housing is now called to order. For the record, today is Monday, June 22nd, and the time now is 9:06. Notice for this budget hearing was disseminated via email to all senators and all media broadcasting outlets. Public notice was issued on Monday, June 15th and June 18th, Thursday. Committee will hear and accept testimonies on Bill 282-35 LS, the Fiscal Year 2021 Appropriation Act, as requested by the Governor, relative to the Guam Behavioral Health and Wellness Center Fiscal Year 2021 budget request. Joining me for this budget hearing is the Oversight Chair of Guam Behavioral Health and Wellness Center, Senator Therese Serlai. We're also joined by Senator Regine Besco-Lee. We have Senator Kelly Marsh Taitano, Senator Mary Camacho Torres, and Senator Jim Moylan. General rules for the budget hearing. The conduct of this budget hearing shall be as follows. Those testifying on behalf of the department or agency will be recognized by the chair and invited to the panel, which they are there already. Written testimony shall be submitted to the committee. Please provide my legislative staff with your written testimony for photocopy. Testimonies may be read, and lengthy testimony should be summarized. Testimony shall be confined to the substance. We will only talk about your budget. Individuals will be allowed to present oral testimony. And once you are done, you may be asked to remain in the room for question or for additional testimony as may be desired by members of the committee. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and or may be asked to leave or be escorted/removed from the room. When you speak, please make sure that the microphone is on and that you speak into the microphone. Please state your name and title for the record. At this time, I ask the panel members from the Guam Behavioral Health and Wellness Center to rise and for our Sergeant at Arms to please swear them in. Thank you, Sergeant at Arms. We will now begin to discuss the Guam Behavioral Health and Wellness Center's budget. Ms. Arreola, I've been informed that you have slides that you would like to present. Please begin with the slides. Sergeant at Arms.
Thank you, Mr. Chair. Senator Therese Terlahi, my oversight, honorable senators who are here, and I'm assuming, I'm not sure if other senators will be joining on Zoom, I guess, or social media platform, but thank you very much for allowing us to present our needs for the Guam Behavioral Health for FY21. So I have submitted a PowerPoint presentation for overview of Guam Behavioral Health, where we're at and our needs. I've also submitted for senators to review, other than the PowerPoint presentation, a copy of the vacated permanent injunction, because I believe that this is the first time, if I recall correctly, that this is the first time we've had an official audience with the policymakers right after the permanent injunction was vacated. So I thought it was prudent for you folks to have a copy of the permanent injunction and see where we're at, where the department's at moving forward, which really outlined and set forth the steps moving forward. Not only the permanent injunction, but being CARF accredited, and I'll get to that in our presentation. So thank you very much, Honorable Senator Joe and Agustin, for having us. I will begin with our slide, and thank you for the assistance of your staff. So our first slide, next please, is I believe the overall arching slide that I need to talk about. As I just mentioned, the permanent injunction. Guam Behavioral Health has been in permanent injunction federal receivership for 18 years. December of last year, it was vacated by Judge Marshall by Judge Marshall. And so you have before you a copy of the vacated order. And if you read thoroughly, a lot of those points that Judge Marshall had mentioned had a lot to do with building capacity within the department. And first, and more importantly, a major concern of hers was to fulfill long-standing vacancies of critical positions. These are vacancies that have been vacant for many, many years. For example, a clinical administrator was vacated in 2014 and has since been never been replaced. And last year, I'm happy to say that I permanized a permanent clinical administrator. So that's 6 years, the concern of the federal judge. Another is the federal medical records supervisor. That had been vacated since 2010, 10 years ago. It has now since been filled. So we have a permanent medical records supervisor. The psychiatric nurse administrator has been vacant since 2013. That's over 6 years of vacancy. When I came in, our administration came in, we immediately set priorities, did a very aggressive but difficult recruitment, and we now have a psychiatric nurse administrator. And probably the most, proudest of all is something that you stood up from the ground up. Guam Behavioral Health has never has had a pharmacist. We had a pharmacy. We've worked with part-time pharmacists who worked in the community but came in after hours to fill scripts that our psychiatrist has filled. But never in the life of Guam Behavioral Health had they ever had a pharmacist. We made that a priority in our administration, and we've hired, for the first time, a full-time pharmacist. That's really critical, and you'll see that Judge Marshall, in one of her items in deciding to lift the permanent injunction, was specifically that. The hiring of critical positions, but specifically she mentioned the pharmacists. And so we're very happy to say that for the first time in Guam Behavioral Health's history, we have a full-time pharmacist that's client-centered, and you will see, and I'll get to the slide of the pharmacy area, why it's so important. I believe that one of the major reasons, and as you read the judge's order, that Judge Marshall saw comfort in lifting the permanent injunction, is that we made it a priority in our administration to make her known through steps that we take in hiring and making improvements in the Guam Behavioral Health, that Guam Behavioral Health is, for the first time, I believe, seen as a major player in the healthcare field. We're not just a side department of Guam Memorial Hospital like it used to in the early days. It is now a major player alongside Guam Memorial Hospital, Public Health, and now Guam Behavioral Health. And if you see in your reading of her decision, you get that sense of comfort that she feels that the department is being paid the attention it deserves after so many years, 18 years. One of the things I want to highlight about the permanent injunction is early on in 2001, when the permanent injunction was first entered into and federal receivership took over, DICID was part of that permanent injunction. And so when FMT, the federal management team, came in, they immediately took all the contracts from DICID, and that is the CARADOT program, the community habilitation, and the respite care services, and they transferred it over to Guam Behavioral Health. I believe the mindset at the time, senators, is that Guam Behavioral Health and DICID was going to be merged at the time. And so since then, and many years after we've gone into receivership, DICIT was no longer a major player in the permanent injunction. And so it is rightfully fitting that efforts to return these programs that are outlined on the slide to DICIT, the more appropriate agency in the government where it belongs. These are clients that are intellectually and physically disabled rather than mentally with mental illness. And I think in the early days, there was quite a confusion, lump everyone together. And that is not the case. Serious mental illness is very different from being born with a physical illness or a physical disability or having an intellectual disability. And that's what DICIT is about. And I believe that the director of DICIT before you, I believe a couple weeks ago, maybe last week, had mentioned these efforts of taking over these contracts. And so I wanted to also reemphasize that efforts to move these appropriate DICIT contracts back to DICIT are ongoing. Next slide, please. So, besides the good news of getting out of the permanent injunction of December of last year, an overarching responsibility for the department is that we are CARF accredited. And so back in 2017, the department received CARF accreditation, Commission of Accreditation of Rehabilitation Facilities, and the department was given a 3-year, which is the maximum number of years for accreditation. That accreditation was up in June of this year, but because of COVID, it was immediately extended. The accreditation term was immediately extended to December of this year. However, knowing all the things, not knowing the unknowns of COVID, you will see that I attached a letter in which I requested, and their response from CARF, where I asked for a pushback for the survey. And so we are no longer looking at a summer survey for reaccreditation, but a fall survey of this year. And it will probably be a hybrid. Normally a surveyor will come out physically, depending on how the island is doing in receiving visitors. It might be a hybrid between virtual survey and possibly somebody coming out. But just so you folks know that the accreditation is a major accomplishment of the department, and we are now going to be up for reaccreditation this year, but no longer in the summer, but this fall. Next slide, please. As I mentioned earlier, Guam Behavioral Health is the first and only recognized government of Guam agency to receive the highest and maximum 3-year level of accreditation by CARF, and they received it in 2017. Why is accreditation so important? It's a seal of excellence that treatment and services meet national standards and is also very much a plus when seeking federal funding. The federal government likes to know that the people that they're giving funds to are held at a higher standard and constantly checked on that standard. In order to maintain accreditation, Guam Behavioral Health is expected to operate in conformance to CARF standards and comply with the quality improvement plan that was submitted to CARF in response to the recommendations that were identified during the initial survey in 2017. And so the department and the hardworking employees of the department have been working diligently to improve on those improvement plan outcomes that were identified in the initial survey. And they've been doing that and improving how our processes and how we handle policies and situations in the department. And so it's always about moving forward, not necessarily getting it perfect, but making sure that we're constantly checking and double checking ourselves and our policies and our processes so that it meets national standards. So the people of Guam and the senators and our lawmakers, our policymakers, be comforted knowing that Guam Behavioral Health is not just running on its own set of rules and processes, but Guam Behavioral Health is held at a highest standard of CARF accreditation. And I think that's really important for the people of Guam to know who seek our services, that it's just not us that's looking at us and our processes, but also nationwide, an international body, recognizing that we're doing things right. Thank you. Next slide, please. So the next couple of slides these are the programs in which the department has been credited for and will be going up for reaccreditation in the fall of this year. Adult Mental Health Outpatient Program, and that involves intake, community support services, counseling services, community home-based services, psychological services, psychiatric services, and individualized treatment plans. Of course, our Child Mental Health Outpatient Program, known to many of you as IFA. We take care of our young, and that involves accreditation was looked at for wraparound services, care coordination, case management, counseling services, intake assessments, individualized treatment plans for our children. A very important and another program that was accredited is our Crisis Stabilization Program. And that you may know as our units, our inpatient units. Our adult inpatient unit is at 16-bed capacity, and child inpatient unit at 16 as well. Our drug and alcohol program is accredited and will be going up for reaccreditation as well. And you know that, and many of our island residents know it as New Beginnings, and how appropriate. So our drug alcohol program is accredited, and we're accredited for intensive outpatient services, and medically assisted treatment. Our crisis intervention program, many of you know it as Healing Hearts Crisis Center, is Guam's only rape crisis center. And we are accredited for medical legal examination, crisis intervention, and advocacy support and referral service to victims of sexual violence. Our residential treatment program is accredited and will be up for reaccreditation as well. And that involves 3 adult group homes and 1 child and adolescent group home, known as Serenity. Again, our prevention family services is also accredited and will be up for reaccreditation as well. Many of you know our prevention branch as the Peace Office. We're accredited for providing technical assistance and mental health and prevention education opportunities and creating awareness on reducing alcohol, tobacco, and other drug use and their related problems. Next slide, please. So I've just finished what we're accredited for, and now we're going to get to some data, which I think everybody is always looking at data. So I wanted to share with the senators a snapshot of our clients served. Since entering Guam Behavioral Health, and I will show the 2019 data, we have served 3,681 residents on our island. Of that, 628 are children, 2,864 adults, and we've broken down further of those adults, 189 are our most vulnerable, Armanumco. The breakdown for male and female are shown, and as you can see, male is predominant, but not far off are the females seeking help. Part of the adult population, and I wanted to single that out because drug and alcohol is such an issue for our island, is of the 2,864 in 2019, 579 sought drug and alcohol services from our department. Compared to 2020, and here we are 2020, but we're not done. It's just year to date. We're already at 3,189. 222 is specifically for COVID period, which is ongoing, but I gave you the figure up to June 17, which was last week. Children is 537. Again, these are numbers, and we're not done with the fiscal year compared to 2019, which is the full year. Adults is 2,487. Of that, 165 are our most vulnerable, arm and uncle. Male consists of 1,777, and female seeking services from the department is 1,412. Of the 3,189, so far to date, 444 clients have sought drug and alcohol services. Next slide, please. I wanted to give you a glimpse of how we fared and how the data during COVID. And during the declared health emergency, we stood up a 24/7 crisis hotline, received 1,150 calls for the period of March 15 to May 31st. Currently, we're still collecting data, and that's why you don't have a June data, but I decided to give you up to May 31st. Our evaluator is still putting the evaluation together. But during the period of March 15 to April 25th, the total number of calls increased each week as more news of the coronavirus positives and deaths and other COVID-related restrictions were announced. Calls started at an average of 23 calls a week, but at the height, we received that many a day. The highest number of calls per week was seen immediately after the presentation of Guam's COVID extended trajectory for purposes of intervention efforts and readiness benchmarks, which was presented by the Governor's Physician Advisory Group. And the following day, Guam saw its fourth COVID-related death. And so the numbers increased as the deaths in the early days unfortunately came about, and more information about COVID was shared. And it makes sense that these calls were more and more because our community became more and more anxious about this unknown pandemic. Next slide, please. So, our budget. A budget summary is presented before you, Senators. From local funds, Guam Behavioral Health is seeking $24,545,000. Of that, $24,159,000 is requested from the Healthy Future funds, and $386,000 from the general fund. I wanted to share how much federal dollars Guam Behavioral Health receives, applies for, and receives. We are looking at $7,561,000 of federal dollars. The breakdown from SAMHSA is $5,825,000. From the Department of Interior, $1.3. From FDA, $311,000. And from Edward Byrne grants through a partnership with, as a subgrantee of the Bureau of Plans, Statistics and Plans, $125,000. That's broken down at $75,050, $75,000 for drug and alcohol. I'm sorry, $75,000 is from Healing Hearts Crisis Center, and 50,000 is from drug and alcohol, for a total operational budget of 32 million. However, I'm only seeking 24 million from the legislature. I want to note that the federal grants that we receive also do not require a matching from the government of Guam. It's 100%. Next slide, please. So a little breakdown about our federal grants. First of all, as I mentioned earlier, these are federal grants that were received, that were applied for and awarded to the department. And I want to make note, senators, that we do not have a grant writer. We do not have a grants division. But yet, 1/3 of our operational funds come from grants that we apply for and receive. And I want to take this time to especially thank our managers, who are probably watching, because they're all curious about today's budget hearing. And most specifically, my deputy, Carissa Pangilinan, and the grant team that she pulls together to seek these grant applications and ensure that they're properly processed and submitted. And so special thanks to my staff, managers, the deputy, and the grant team. The grant team we have, senators, is we've identified staff who have the skill set to put together grant applications for the department, and we pull them from their duties that they were hired to do during specific grant periods to put these grants, to assist in the grants application. And so again, there's no grant staff. The grants are applied for by staff outside a part of the duties that they were hired to do. $7,561,000 is all because of their great efforts. So thank you to the wonderful staff of Guam Behavioral Health. The breakdown for the federal grants, again, you can see that SAMHSA, as I mentioned in the earlier slide, is $5,825,000. That various grants. Project Talika is in year 2. It's $902,000, and it serves health. It's a healthy transition for adults, young adult ages 16 to 25 with serious mental illness. Our Project Link is $1 million, and we're on year 1. Serves ages 5 to 18 with serious emotional disturbance, experiencing homelessness. Partnership for Success is in year 2, $500,000, and this is partnered with non-government organization or NGOs in the community to provide prevention strategies in the community. I'm very familiar with PFS because during my stint at Sanctuary, we applied for the PFS grant, and Sanctuary received it. I pray, and I'm not quite sure, but I believe that they continue to be a PFS subgrantees. Guam Focus in Life, $736,000. We're year 1 of 5 years. It's suicide prevention. PATH, $50,000 for homeless individuals with serious mental illness. Of course, we have our Community Mental Health Block Grant, which is a formulary grant every year, $437 this year. Substance Abuse Prevention Training Block Grant, $1.3 million for substance abuse and prevention treatment services. Guam Opioid Response Program is $250,000 this year. Transformation Transfer Initiative, $150,000, and it provides incentives for the engagement of treatment. We have awarded outsourced this service to Gumamami, and they provide the incentives through the subgrantee of $150,000. Emergency grants to address mental and substance abuse disorder during COVID-19. This is the grant that COVID-19 made available to all the states and the territories. The territories' max ceiling was $500,000, and we received it a week after putting the application in. So we have that as well. So that totals all our SAMHSA grants for $5,825,000. In addition to SAMHSA, other federal funders are Department of Interior of $1.3 million. And as we've talked in the past, and you heard me say before, that is going to be dedicated to the 3.7 inpatient detox unit startup costs. These are funds from previous DOI years that when coming into 2019 into the department, I saw fitting to reprogram and prioritize for drug and alcohol 3.7 detox. FDA tobacco enforcement is $311, and that's specifically for compliance of surveillance of tobacco sales in our mom and pop stores. Recovery-oriented systems of care, again, through a subgrant from BSP, the Edward J. Byrne, $50,000 partnership with the judiciary system, and New Beginnings, our drug and alcohol division. And last but not least, our forensic medical exam of sexual assault, another subgrantee from Edward J. Byrne for the Bureau of Statistics and Plans at $75,000. So I just wanted to show the senators that we are constantly trying to do our part to maximize all the federal grants that are out there for the department. And so the proof is in the pudding, $7,561,000. So I'm very proud of this because again, we don't have a grant department, we don't have grant staff. This is our own staff who was hired to do other things, pulling together and knowing it's the right thing to do and seeking these grants out and helping our government by seeking grants rather than relying just on our government dollars. And we will continue to do so. Next slide, please. This is a glance of our organizational chart, and you can take a look at that at your leisure. Next slide, please. Human Resource and National Health Service Corp. Again, I need to take this opportunity. I'm going to give you a glance of where we are in our employee count. But first, I need to thank all my staff, all 213 today. Thanking them seems not enough, but I need to do that, and I need to do it in front of this body, because 213 employees of Guam Behavioral Health, I just want to thank them for their dedication and service. Guam Behavioral Health never closed during COVID, and these employees, they performed their duties with the same anxieties and fears that every one of us experienced. And so, as some departments were able to stay home and concentrate and focus those energies with their families, essential agencies like Guam Behavioral Health, Public Health, GMH, first responders, departments, had to ensure that they continue to do so with the same fears and the same anxieties that everyone else had to bear. So it is rightfully fitting that I take this opportunity to thank them wholeheartedly for their service and dedication, constant service and dedication, but more specifically, being able to continue to provide those services during COVID and the public emergency. So thank you to the 213 staff at Guam Behavioral Health. Of the 213, 159 are classified. 54 are unclassified, but it's not the unclassified of the past. So many people often think 54 unclassified, those must be political appointees. The only political appointee is Carissa and myself. 54 are from grants. Because we get a lot of grants, we hire through the grants. Grants are not classified employees, they're unclassified employees. Contractual services are professional staff, like our psychiatrists, our psychologists, our pharmacists. All our contracts to ensure that we get the highest quality for the national standard salary. So we're competitive in that respect. We have many hiring platforms, as you can see, but one of the things that I wanted to highlight is Guam Behavioral Health's effort last year. We, through the partnership of PHOA, we sought their assistance and we applied for the National Health Service Corps application. Why did I feel that that was fitting? Because we needed to be competitive in an arena that there are so little psychiatrists and psychologists already. And so it's not about why are we not getting our psychiatrists and psychologists to Guam. There's just a nationwide shortage of them. And to be nationally competitive, we needed to think outside the box. And so this is thinking outside the box. We partnered with PHOA. They assisted us. We put in our application. And today I'm happy to say that Guam Behavioral Health is a certified site for the National Health Service Corps. What does that mean? That means it's a recruitment tool. That means I can offer psychologists and psychiatrists who probably walk out, with huge student loan payments, the ability for loan forgiveness through this program. And we have received many leads and actually several of our current recruitment for psychiatry has come through the National Health Service Corps opportunity. So this is really good news. I believe we are the only, no, I take it back. Public health is also a certified site, but we are the second. And that's thanks to PHOA, and I think that's a very good resource that we're engaged with in a regional level. Next slide, please. Patient Affairs and Business Office. This was set up, I know that Senator Therese Terlahi and I believe maybe another senator speaker, thank you for being here, joined us in that ribbon cutting when that was one of our first major construction projects, if you will, last year. We set up a patient affairs area, constructed that. We saw that this is a priority of our administration. And so we immediately constructed and set up a patient affairs business office. This houses billing. Very important, right? Money, money, money. So what senators did back in 2012, and I believe it was then Governor Leon Guerrero's bill that proffered the fee schedule. So since 2012, Guam Behavioral Health has had a fee schedule in the books. We are currently billing for psychotherapy and medication. Services are provided, and I want to stress, services are provided regardless of the ability to pay. No one is turned away. And that needs to be very clear. Yes, Guam Behavioral Health is aggressive in the billing, but no, just because you don't have insurance doesn't mean you cannot seek our services. That is so, so critical for everyone to understand. So since 2012, The department started billing efforts, small billing efforts. 2014 started to 2018, that's 5 years. They collected a total of $26,000. Come 2019, a priority of this administration, billing, get as much money as we can. It doubled. I mean, not doubled, I don't even know what that is. That's a lot compared to 5 years collectively. But that showed where the priority laid, $205,000. And this year alone, and we're just in June, we've collected $472,000. In FY 2019, Guam Behavioral Health prioritized. One of the reasons why we were able to, it's not just the lip service of let's start billing. It's actually putting some real teeth to it, hiring somebody who will focus on billing rather than just giving other staff a collateral duty when they have time to try to help with billing. So what we did is we immediately hired a claims specialist. So we have one current claims specialist. And right now, the process, literally right now, the process of interviewing is a second FTE claims specialist. That's our commitment to billing, real commitment to billing. Guam Behavioral Health currently bills Guam Medicaid. And back in last year, when the governor was able to get 100% reimbursement, the cap lifted, I immediately engaged a vendor to do back billing for a year. And that's where you see a lot of the 205 effort. Because if it was just for that one person to do, she couldn't do it. I needed to engage a temporary vendor that will help in the back billing. So those are the efforts. And I believe, if I'm not mistaken, and maybe Debbie, you can refresh my memory, I think for every invoice that the vendor prepared, they only were paid a dollar sum for the process, for billing. So the return of investment was incredible. I mean, it was some very minimal vendor fee for every claim submitted. And so, again, the efforts show 205. When you put effort and priority to something, it jumps. And it clearly jumped in 2019. So as I mentioned, we bill Medicaid. A lot of that is the back billing. And the governor received 100% reimbursement from the federal government, and we definitely moved forward. I think the deadline was in November, and I started like in July, and so for a period of 4 months, those were efforts that were well received. Currently, we have provided agreements with our third-party private insurance providers. They are in the process of reviewing our agreement. And as of yesterday, I saw a couple in my email box. So we're literally in the process of signing those agreements and coming to signed agreements with our healthcare providers, Aetna, Calvis Insurance, NetCare, Staywell, Take Care. Guam will be fully credentialed and begin submission of claims in July, so next month. We believe these agreements with the third party will begin next month. And so many, because Guam Behavioral Health is the only state mental health department, there are many private practicing therapists, psychiatrists, I shouldn't say many, a few. But the majority of our people or the community come to Guam Behavioral Health. And so there is an abundant ability to raise and collect from our insurance providers. Many people that I know personally. come through our center. And I know they have insurance. So we'll be able to bill their insurance company and receive for the services that we provide. One thing that was not, I'm sorry it was not put on the slide, and I really wanted to mention, is probably by the end of July or August of this year, in addition to signing insurance agreements so that we can start billing insurance companies, is we are submitting our CMS certification application. What does that mean for the department? When we submit, this would allow Guam Behavioral Health to bill Medicare. Now, we're submitting the application and we'll see where we're at. I'm always one to believe that it's important. We need to submit the application. If we get denied, that's okay. We'll know where we can improve on. Until we submit, we have no clue where our standing is with CMS. And so I'm happy to report that those efforts are ongoing, and we're looking at either late July or early August to submit CMS application so we can begin billing Medicare. And we'll have, if everything goes well, we will have by next year billing of Medicaid, Medicare, and insurance providers. And the department will do its part in collecting for services that we provide our community. Thank you. Next slide, please. Training and development. Important to tell you this because this is CARF, very, very CARF accredited linked. When a department or an organization is accredited by an international body, as I stated earlier, it's not just to ensure that we're held at the highest national standard, but it's to ensure that the employees and the staff we have are constantly focused on building their capacity to serve better. And so I'm happy to announce that Guam Behavioral Health staff is constantly in training and development. And as you can see, they have annual recertification and refresher trainings in all these areas. Especially for first aid and PCMA. These are trainings that, especially in our residential department and homes and units, that are critical in the event that a patient or a client is agitated. They can properly assist in calming. I don't want to say restrain because we don't restrain, but assist them in the proper method of calming them without physical abuse. And so that is really key. We are constantly training our staff. First aid, of course. You can't be in the homes or the units if you don't know how to perform CPR. And of course, the training division of Guam Behavioral Health provides for all new employees, and as well as open up to partners and other community members, nonprofit organization that we feel is our responsibility to help build capacity and help them get more training. So we allow them to join in our trainings as well. All the customer trainings, customer service, HIPAA, corporate compliance, ethics, grievance, sexual harassment, and our annual health and safety fair. Thank you. Next slide, please. Professional support unit is comprised of psychiatry, psychology, and our pharmacy. Next slide. Psychiatry. Our psychiatrists provide complex psychiatric medical work in the field of psychiatry that is involved in the administering of psychiatric services to inpatient units, department divisions, and branch programs. It assists in direct and indirect patient care, coverage of outpatient services. Currently, we have 3 full-time psychiatrists. I'm happy for them, but sad for the department. 2 will be retiring at the end of this year. However, 1 has stated that they are willing after an extended vacation, maybe 3 to 6 months, will be coming back to us part-time. So that is why the recruitment tool that I mentioned earlier is so important, because this is a growing population or arena of professionals that are aging. I didn't say aging out, Senator. Aging. Senator Joe looks at me. They are aging. There at one time, many people got into psychiatry, and they're aging. And so when I say aging, they're at the age of retirement. They're definitely not done with life. But deservingly, they deserve to enjoy their retirement. And so it's important that we go after and make sure that we go after national recruitment areas like that I mentioned earlier. We are actively recruiting, meaning I've had actual interviews through Zoom with 2 potential psychiatrists and 2 advanced nurse practitioners who will be assisting the psychiatrists with script writing. And so that's the plus side. So if all goes well, we will probably have 5 before the end of the year, with the retirement down to 3.5, not including the advanced nurse practitioners that will be assisting the psychiatrists. So we're holding our own, but again, I encourage, I'm not sure what we can do about encouraging our young folks to get into this field, but this is the field to get into, behavioral health and wellness, because we need more and more psychiatrists, counselors, drug and substance abuse counselors. There's just not enough on our island, but there's just not enough around the world. And so that's something we definitely need to look at. When there was a shortage of teachers, a shortage of nurses, there was a push to recruit. I think we need to look at something like that for this area of study and practice. Next slide, please. Psychology. Psychological services provided at the department. Of course, we provide services to all ages across the lifespan development. Our psychologist does assessments, testing, conducts psychological evaluations, provide relevant treatment recommendations, provide evidence-based and culturally relevant psychotherapy services such as individual, couples, family, and group therapy. They provide consultative services to outpatient, residential, and inpatient treatment teams, and they provide supervisory training for practicum students, interns, or postdoctorates. Currently, we have 1 clinical psychologist, and I am happy to report that the contract is routing now, and it should be, I believe, at the AG's office at this point, for an additional psychiatrist that will start next month. And I'm happy to say that this psychologist is homegrown, come back home. So that's very good news for us. That's what we want. So definitely before the end of this fiscal year, we'll have 2 psychologists at the department. Next slide, please. Pharmacy. As I stated earlier, it was one of the key points of Judge Marshall's vacating the permanent injunction. We have a pharmacist in charge, first ever full-time pharmacist. She started August of last year. What did that mean to the department? It meant a lot. I was facing pending sanctions from the pharmacy board and loss of our DEA license. If I did not show our pharmacy board that we were already actively recruiting in early summer and them giving me the allowance to see how that recruitment took place, it definitely diverted pending sanctions from the pharmacy board and the loss of our DEA license. As Judge Marshall stated in her order to vacate, the previous issues in obtaining an adequate supply of medication for its clients had been substantially rectified by the hiring of a full-time pharmacist. And so we're really happy that we have a full-time pharmacist, because that means we have a true pharmacy in place. First time, new pharmacy, client-centered. What does that mean? Client-centered is all accreditation jargon. Everything we do must be client-centered. The department did what they could do by having part-time pharmacists, but those pharmacists came in the evening. They saw the scripts in the evening, they filled them, and our patients and our clients who are already struggling to come because of transportation issues and things of that nature had to come back the next day to pick up their prescription. That is not client-centered. This allows our patients, just like when we go to the doctor, to go to a pharmacy that's open and ready to serve them during normal working hours. And so our hours are Monday through Friday, 8 to 5, government hours. An average of 50 scripts are filled per day, which was previously 21 a day. Sometimes the scripts filled reach 120 scripts a day, and that's because she's there. She can actually work 8 hours filling the scripts that the doctors and the psychiatrist fills out. You can see that in 2019, 6,392 scripts were filled. This year, year to date only, 9,213. Some people might say, wow, that's a lot of medicine. But for us, we see that as wonderful. Why is that wonderful? Because more people are taking their medication. More people, and helping them live stable lives. Reducing the incidence of crisis in our patients, reducing the incidence of sometimes suicide. So when prescriptions are filled, we're happy because patients are engaging in picking up their meds and taking them. This also, because of the pending sanctions we had, I should say that we did have to do major renovation at our pharmacy. And so those renovations allowed us to be in compliance with Guam Pharmacy Board expectations. So it really is a renewed pharmacy, and I'm very happy and pleased that we have. And I know that the department is, our patients are definitely benefiting because of our pharmacy. Next slide, please. Nursing Service Division. As I stated before, our nurse administrator position was vacant for 6 years. Last year, we filled it. This is the nurse administrator that oversees, is the supervisor, if you will, the crisis, the units, med clinic, and will be supervising the staff for the Detox 3.7. I will explain with regards to the crisis stabilization units. I mentioned earlier adult and children were part of the accreditation. Warrior unit, you're probably wondering, I'll get to that when I talk about COVID impact. Next slide, please. Our crisis stabilizing units, adult inpatient unit. In 2020, year to date, 294 admissions, 102 are unduplicated. Average daily occupancy was 71%. This rate increased 75% in March as a result of the increased court order admissions. 6 out of 8 are still remain to date. Average daily occupancy continued to increase with 86% in May. And this month alone, it rose to 100%, as compared to quarter one of last year at only 42% occupancy. Our other unit, children inpatient unit. Year to date, 24 children have been admitted to that unit for stabilization, all unduplicated. The warrior unit, named very specifically and very purposely. We stood up the warrior unit as a result of COVID-19. It's a unit that we put anyone who was deemed persons under investigation of possibly being positive and pending test results. We used the unit thus far for 1 adult and 1 child in April, and happily to report that both were negative. Today, Guam Behavioral Health remains 0 COVID positive. Medication clinic provides services for outpatients to follow up with psychiatrists' medication management. So our nurse administrator oversees these stabilizing units. Next slide, please. 3.7, heard about, very much needed. We were ready, working towards opening in early May. COVID hit, recruitment. COVID hit in March, slowed down recruitment big time. We are now looking at early next fiscal year or late at the end of the year. 3.7, detox inpatient unit is new or will be new when it opens. Medically monitors intensive inpatient services withdrawal management for consumers ages 18 and above who meet the diagnostic criteria for moderate to severe co-occurring substance use psychiatric disorder. It will have 16 beds. Startup funding was reprogrammed, as I mentioned earlier, from the Department of Interior funding of 2009, 2010, and 2014 that had yet started projects. So recognizing that we needed to stand up a detox unit, and drug and alcohol it still is, unfortunately, every day in the news, and our people need the help. It was decided the administration, that this was a priority to stand up. And so we sought Department of Interior's request. I requested a reprogramming of the programs that 2009, 10, and 14 were earmarked for. They agreed, and so now that's our funding for 3.7, startup. Again, due to COVID-19, the anticipated opening is later in this year, the beginning of the next fiscal year, but what was extended is when COVID-19 hit, the Department of Interior only gave us until this year to use the funding. I immediately wrote to them and asked for an extension. We received word that the extension is moved to next year. So we're not going to be concerned about losing the funding if the startup, for whatever recruitment delays or supplies delays, if there was a delay, we would not jeopardize the loss of funding. So we can spend DOI money for 3.7 until December of next year, but we anticipate opening the unit later this year. Next slide, please. Recently announced, and I'm sure you folks, you good senators have received a copy of the executive order. This is going to tie into a lot of the things I've mentioned of the units being occupancy filled. That's definitely going to help. So Guam Behavioral Health Annex at DOC, I have to mention that meetings with the Lieutenant Governor, Department of Correction, and myself started since January of this year. We were seriously ready to look at rolling this out, getting the executive order out, but COVID-19 hit. It stopped everything. So here we are today. We have an executive order 2020-21 that was dated June 18. Department of Correction inmates deserve mental health and drug alcohol care while serving out their sentence. Guam Behavioral Health believes rehabilitation is necessary to ensure successful reentry of these residents into the community and minimize recidivism. Guam Behavioral Health is required to provide service to the community and the correctional population without jeopardizing safety of the others that we serve. So what does opening a Guam Behavioral Health facility at the Department of Correction mean? It means that the Guam Behavioral Health Tamuning Center will be for our community and for everyone who is seeking our help, and court-ordered and Department of Correction inmates that need services or ordered for services will be at DOC. Guam Behavioral Health is not a forensic unit. We are a community facility. Forensic unit needs the security measures. Having Guam Behavioral Health at DOC means that it has the security measures, but yet we're still going to go in and serve them and provide the services they need. This would definitely eliminate court order and DOC inmates at Guam Behavioral Health AIU, which is a concern because I mentioned earlier. The Tamuning facility is not a forensic, and we don't have the security measures in place for DOC inmates or court-ordered inmates. From time to time, and I say that is because from time to time, DOC inmates get admitted to the Tamuning Center, and DOC guards have to come in and guard them. Totally not conducive for therapy and recovery for other community members that see this. Their anxiety, they're in the unit for obvious reasons. They're in crisis, their anxiety is high, their level of fear is high. All you need to see is somebody with a gun, and that even makes it worse. So we needed to do something major. There was always a concern of DOC inmates running. I think it was last year, we hit the news with, an inmate escaping, and that's because, again, the Tamuning facility is not a forensic unit. We don't have the security measures in place like the Department of Correction does. And so I am so happy, I am so pleased that it's such a wonderful working relationship with the Department of Correction Acting Director Joe Carbolito. We're in the same mindset. We need to help our people, whether they're behind bars or outside, but we got to do it in the environment that is necessary. And so there is an identified unit at the Department for Correction, and we will begin having further discussions. This executive order gives us now the legal authority to really stand up this process and manage the Department of Corrections mental health and drug and alcohol programs. And, you know, the more we do this, the better rehabilitation. It's important because we're going to see, they see the same people making the same mistakes. These are our brothers, these are our residents who are brothers and sisters who've made mistakes. Yes, they made mistakes, and yes, they're paying for it. That's why they're sentenced to DOC. But we need to help them. We need to help them get the help they need, the mental health they need, the drug and alcohol help they need, so that when they leave at the end of their sentence, they have a surviving chance to really be contributing members of our community. And so I'm very excited. I know it's a lot of work, but it's good work. So moving on, thank you. Clinical Service Division. Comprises of community support services, adult counseling, residential recovery program, drug alcohol services, and healing hearts. Community support services is under the umbrella of the clinical division, provides and develops supports the recovery of adults with serious mental illness and their families. It provides, included but not limited to, assessments, psychoeducation, crisis intervention, case management, and supportive counseling. Community support service is part of the interdisciplinary team that provides comprehensive clinical care to the population we serve, ranging from transitional ages 16 and a half to the elderly. Community home-based service is within the purview of CSS, Community Support Services, and I just wanted to just talk a little bit about community home-based. I love this program. I mean, I love everything that Guam Behavioral Health does for our community in need, but this program is very dear to my heart. Community home-based, our staff goes out to patients' home and make sure they're doing okay, making sure that they're taking their meds, talking to them, linking them to services that they may or may not need, or they may need. So this is a very personal service we do, but for this population we serve, very much needed. Sometimes they just need somebody to talk to. Some of them to remind them, did you take your meds today? Some of them live alone and don't have the luxury of family members helping them stay on track with their medication. Community home-based really helps stabilize our patients who are at home, trying to live stable lives. Adult counseling, next slide, please. Next slide. Next. Provides therapeutic services that address a broad spectrum of mental disorders. It also provides group therapy, suicide-safe therapy, first aid groups, seeking safe groups, social skill development groups, medication and management life skill groups. So adult counseling is exactly what it is. It provides counseling to clients that seek counseling services, and it also provides groups for these clients. Next slide, please. Residential recovery program. Residential recovery programs provide transitional living services to adults with severe and persistent mental illness. The program has varied levels of care based on the supervision needs, behavioral concerns, and assistance needed with activities of daily living. 3 levels of care are level 1, 2, and 3. Level 1 being the most significant severe behavioral concerns and needs. We have a program capacity of 27 beds, 23 of which are currently occupied, 4 homes, Guma Pahong, Guma Serenidad, Guma Esasena, and Serenity Youth Home. Next slide. Guma Pahong is located in Dededo. 3 out of 4 beds are occupied. We serve adults with severe mental illness and severe behavioral problems. These residents need regular assistance with their activities of daily living, and this is the most restrictive level of care. Next slide, please. Guma Serenidad. I want to thank the Gora Ray Tapasnia and the Gora Department for assisting us here. We were able to partner with Gora and we received Guma Serenidad. This is a Gora property, which allowed us to eliminate 3 rental homes and saving on rental costs. So this is located in Agate, 11 out of 12 beds, adults. We serve adults with severe mental illness who meet HUD's eligibility criteria under the Permanent Supportive Housing Program. It is the least restrictive level of care. And so it's a wonderful partnership with Gora. And like I mentioned, what we did is we consolidate many rentals we have into this partnership with Gora, and we're able to save out of 3 rental homes, no longer renting. Guma Azucena, dear to my heart as well. Located in Asin, 6 out of 6 beds are occupied. Our most vulnerable population that we take care of. Severe mental illness and dementia, cognitive disorders, and other, as they get older, more and more medical concerns. Next slide, please. Serenity Home. Located in Upper Tumon, 3 to 5 beds. We serve youth. It's a step-down home for youth. Provide services to a more permanent so that they can, in between finding a permanent placement or independent living. This is a step-down home for children who were removed from their home for one reason or another, and it's a transitional home until they get the services and their families get the services, and we're able to safely return them back to their families or a more permanent placement. Next slide, please. Drug and alcohol services, known to you all as New Beginnings. We provide outpatient and intensive outpatient programs. You know, some of our programs out there in the community. It was not included in the slide, but worth mentioning, of course. Contracts with partner NGOs, Salvation Army, Oasis, and Sanctuary for our youth. We contract these NGOs to provide residential and outpatient services. New Beginnings or Guam Behavioral alone could not handle it. In the near future, we are looking at expanding the number of beds for drug and alcohol. We started discussion, again, with GORA, with DYA, and with the governor's office, lieutenant governor's office, of taking over some public buildings that may be able to be refurbished by GORA and expand the number of beds for residential treatment for drug and alcohol that is much needed. So we're in the process of discussing that, and this is potentially the DYA cottage homes in Talafofo that is currently not utilized. We took a field trip out there with the lieutenant governor, DYA director, myself, and Ray Tapasnia from GORA. And it's definitely an asset of the government that can be really, really looked at and potentially used as more beds for residential, drug and alcohol residential services. So more to that when the assessments are done. Right now we're just looking and assessing the possibility. But hopefully I'm crossing my fingers that it will work because it's a great government asset that I believe with unfortunately much renovation needed, so that's why we pulled in Gura. If they're able to do it, we're going to have another wonderful facility for much needed residential treatment for drug and alcohol, for adults that need the drug and alcohol services. Next slide, please. Medication assisted treatment, or MAT, known as MAT, began in 2018, continues. These are for our clients who are in the drug and alcohol program who need medication to properly wean them off of the drug of choice they're in, but medically monitored by the psychiatrists and our nurses. Sometimes people are like, you're using medicine to treat drugs. Well, the difference is illegal illicit drugs versus medical medicine to properly wean them off of these drugs. All under the supervision of the psychiatrists and our nurses, and overseen by the Drug and Alcohol Program, New Beginnings. Next slide, please. Healing Hearts Crisis Center, as I mentioned earlier, is the only rape crisis center here on our island. It provides survivors of sexual assault and abuse with discreet, immediate, and full medical attention. We're in partnership with the Coalition of Sexual Assault and Family Violence, the Guam Police Department, and Attorney General's Office. Next slide, please. Children Adolescent Services, known as IFA-Magonta, is our children's division, serves our children and adolescents and their families with serious emotional disturbance derived from trauma, family discord, abuse, and neglect. It's Guam's first system of care site under SAMHSA and continues to expand the system of care philosophy and our clinical administrative practices to youth and children. Our partners, we partner with other children serving agencies such as GDOE, Sanctuary Incorporated, and CPS. Next slide, please. Prevention and training provides training, technical assistance, and education opportunities for our managers, for Guam Behavioral Health, community leaders, youth and adult volunteers on enhancing mental health, suicide prevention, and preventing or reducing alcohol, tobacco, and other drug use and their related programs. You know that PEACE was very active in the push for increasing the age of 21. Next slide, please. I would be remiss, I couldn't have this presentation without talking about COVID impact to our department. So, again, Guam Behavioral Health is an essential health agency. We were open and we never closed. But we needed to make service modifications. Of course, 100% health screening upon arrival was immediately erected that first week in March that we went into emergency declaration. We suspended inpatient visitation, home visits, and satellite office outpatient services. Why? It was critical that I shut the homes down to secure and to make certain that our most vulnerable patients who are in the inpatient unit and in our homes do not get exposed to the virus. And one of the reasons why I can say today that we, the Guam Behavioral Health, its patients and its homes are zero COVID is because of that lockdown. Of course, families were able to still drop things off, Skype. We did a lot of modification, tried to make them talk to their families a lot over the phone, but one thing we wanted to make sure is that there were no visitors. What did we do during the crisis? Guam Behavioral Health, we developed a crisis assignment. We pulled all our social workers, counselors, peer support, no matter what division they worked for. And we did crisis intake, assessments, and crisis hotline service 24/7. We opened the Warrior Unit, as mentioned earlier. We, as you know, we had a pharmacy that's inside the building. We immediately stood up a walk-up window pharmacy, eliminating as much foot traffic into the building and into the units. And of course, nowadays, telehealth is the buzzword. We are doing telehealth counseling assignments through the pool of all Guam behavioral health counselors. Crisis calls come into the crisis center, a crisis call center. They are either immediately handled by professional staff who are working the crisis call, but if they need further, more intensive help, that's when we refer them to intake, assessment, and counseling services through telehealth. New clients mentioned through COVID is 222, and the hotline data again was 1,150 for that period of time. Next slide, please. Funding obtained because of COVID. CARES Act, 173,499. You saw that in the governor's submission to the legislature. And of course, I mentioned earlier, we took full advantage and applied for the 500,000 COVID mental health grant that was made available to the territories. Territories, by the way, the max we could get was 500,000. The states was 1 million. We got to do something about that, but nevertheless, we got the 500,000. And I wanted to mention to the senators, to you good senators, that we're constantly applying. Applications that have been submitted and we're just waiting to hear back from is the COVID Suicide Prevention Grant, which will allow for $742,000. The SAMHSA Ogeng Lifeline Grant, that is not COVID related, but is an application we're waiting to hear from. That's $4 million. And that is $4 million that we're looking at permanizing a crisis unit. Funding the hotline unit, its staff, and the crisis mobilization team to dispatch mobilization teams to areas in the community that immediately need crisis intervention. We have an application with GURA for HUD for their CDBG grant, $7 million, drug and alcohol building. Currently renting, drug and alcohol division is renting. We need to move drug and alcohol division and children's unit back up to Tamuning. So we can better collaborate with our other divisions of the department. It's very difficult to collaborate when we are physically so far apart, yet needing each other's services on a daily, if not hourly basis. The current, that proposed building is the extension, if you recall, Guam Behavioral Health's, that huge pavilion we have. Nice pavilion, but really, it deserves a 3-story building in that site. We need to get everything centered so we can better coordinate with the staff from the drug and alcohol division as well as adult and all our services that we provide in the main center in Tamuning. Another submission application is COVID related, and that is to stand up the isolation house. Guam Behavioral Health owns a home near one of the homes near GMH's emergency room. That GURA COVID we applied for, that's GURA COVID money provided by HUD for $304,000 will be cost shared with the COVID mental health grant that we earlier, the $500,000. A little bit of money is there for renovation. But that will stand up an isolation home versus a unit, versus the Warrior unit, an actual home for COVID. But more importantly, it'll be finally renovated. For COVID related, for future needs of the department. And also we have 2 applications that we're currently working on. The earlier 4 are applications submitted and we're just hearing back. The last 2 are the 2 applications that we're currently working on. From FEMA, the Crisis Counseling Program, that's because of COVID, and that's more of an outreach. And the second application that we're working on is with FCC for telehealth funding. And this, I put Mayor's Office because this allows Guam Behavioral Health's reach into the community, setting up, in partnership with the Mayor's Council, a telehealth desktop, little office space, dedicated office space in the Mayor's Council, so that our patients who live in their village do. Next slide, please. We're almost done. Service contracts. As I mentioned earlier, these are the 3 service contracts that we are looking. Efforts to return to DICIT are ongoing, and DICIT is the more appropriate agency. That's the CARADOT program. Those are 3 homes, CARADOT A, B, C, community rehab, community habilitation, and respite care. Community habilitation and respite care, respite care is really specifically for relief for families who have been caring for their loved one. Absolutely nothing to do with serious mental illness. These 3 contracts are vital, need to be kept. We need to keep them going, but they're inappropriately placed at Guam Behavioral Health. Next slide, please. These 2 contracts that we have are appropriate for Guam Behavioral Health, and they're Mary Claire Home and Hinanauta, and they're both contracted out to Gumamami. So more homes for our serious mental ill residents. And last but not least, last slide, Undangklu na Situas Maasi, Chairman San Agustin, Honorable Senator, Speaker, Senator Therese Terlahi, my oversight. Thank you, senators who attended. And to the senators who are watching, thank you very much. Again, thank you very much for the opportunity to share with you our plans, our successes, our dreams for the department. And as part of the thank you slide is a recapping again of our financial needs for the department. And so I hope to get your full support. I think, especially now in this day and age with COVID still going on, we're still on core 2, we're still in the crisis. More and more uncertainty, depression, anxiety about COVID alone, our drug issue in our community. The stigma is down. More and more people are accessing services. I'm so happy. Our people deserve to get the help, to get the medication they need so that they continue to live productive and stable lives. That's what we're here for, and that's my promise to you folks. Thank you.
Thank you, Ms. Ariola. First, I'd like to thank and commend the staff, your staff, for what they've done during the COVID and what they're doing today, what they've been doing. Put it this way. They've come a long way, and there's still a long way to go. So I'm going to go ahead and ask you just a few questions, because it was a great and long presentation, and thank you. It's good information. I think the people of Guam appreciate this. In FY 2020, your current digest showed you have 47 vacant positions. In FY 2021, it increased to 63. What are your plans in filling these positions of the 2020? How does it look right now?
2020 is going well. Actually, we have so many recruitment. We're in the process of so many recruitments. A lot of that of 2020 is 3.7.
Okay.
So there was really a delay in the recruitment when COVID hit. And so many of that, about 23 positions are strictly for 3.7 opening. But they're ongoing. We push. We're interviewing practically every other day, you know, just making sure that we're hiring the right people with the right credentials. And so we're doing our best, and I think we're going to make it. We're pretty aggressive. I'm known as the aggressive one.
Obviously, you are. There's nothing wrong with that.
DOA, the partnership with DOA, the partnership with BBMR, they hear from me weekly, if not daily. And so those partnerships are valuable in moving the recruitment along. Okay.
On equipment, you have 10 desktop computers, and the prices are different, 1,500, 1,600, 2,000. Could you explain that on your procurement side of the house? I'm just curious, are there better computers? I mean, are there upgrade computers? What are they? You have 10 desktop computers.
Software possibility. Now we're trying to change out all computers so that upgrade where everybody has a camera. Now it's a necessity. Telehealth, Zooming. Believe it or not, the lowest desktop in the government of Guam was often bought, right? I mean, because we need to get the best fare. Doesn't have the little computer. Many people are breaking out their laptops because laptops naturally have the camera. We're upgrading everything.
All right, okay.
So that we're able to Zoom and meet, but also telehealth is critical. We need to have the ability and not having to run from one computer to another, or can I use that office because that office has a desktop with the camera.
Okay.
So we're doing a massive change in all the computer system in the department.
Okay, simple question reference to the 7 computers. Before your time in 2014, they're waiting for MIS. Has that been resolved? All those 7 computers that were purchased in 2014, are they upgraded? Are they got rid of?
That's part of the upgrade. All the computers that we have today, plus the many more that we have to buy for the many staff that I'm bringing online.
Okay.
All need to have that top of the line. By the way, you know, we're purchasing our Zoom, the professional Zoom with HIPAA compliance and HIPAA security. That's all bought. That's part of our COVID, the $500,000 for mental health, the grant for COVID, because, you know, the current Zoom that many people are using are free and there's limited time and not so many people can get on and so forth. So all these new technology that we need to purchase is all part of providing the services online and telephonically and telehealth.
I understand. Thank you. Capital outlay. You have a 40-ton unit. Is that for your building you own or your building you're renting?
So one of the major things I had to do when I came in last year was to replace a 20-ton unit in the center's main building.
Is that a government building?
Our current building. The 40-ton.
It's a government building, right?
The government building.
Okay.
The department.
Then I don't want to ask the question. Then it's our own building. Just fix it.
It's ours.
Okay.
Yeah.
You've got vehicles. You have passenger vehicles. You have 4, and you have 1 flatbed truck. Can you explain? Are those for movement of constituents or patients?
No, the vehicles are throughout the agency needs. Home-based needs. We make home visits, adult counseling.
Flatbed truck?
Flatbed truck. That's basically for transporting for our maintenance, who go back and forth from different, you know, we have the homes.
Yes.
So the need of moving out, we're often having to borrow a flatbed or a big van or whatever you call those vans, a step van, I think it's called step van, to move old beds, old furnitures, refrigerators, stoves that we need to supply the homes for. because we
All
have
right.
homes that we supply. So
Okay.
it's more for maintenance and for our maintenance and facility crew.
Okay. Nonprofit, are there any nonprofit organizations receiving funds for FY 2020?
Oh, yes, I made
And have they-
mention. Of
and have
course, we
they-
have the
have they
drug and
received
alcohol, the 3 drug and alcohol. And all the contract services that I mentioned, Catholic Social Services, Gumamami, and Oasis, Sanctuary, and Salvation Army.
Have they been audited and are in compliance?
Yes, and we also have a grant compliance under the CARF division, that we make sure that they're complying to the contracts as well as the services that they're supposed to.
Okay.
But you're speaking specifically on the required audit, correct?
That's correct.
Yes.
Okay.
We don't go into partnership without them.
All right. As you mentioned, you're working with GURA on funding for buildings and so forth. Have you ever considered, because I know that the area you're at in Tamuning is quite small. Have you ever considered working with GURA to relocate and get a bigger area and get the building 100% federally funded?
Relocate the whole center? The
Yeah.
whole center?
Yeah, the whole center, just move. I drive up to GMH and I go past your building, and that building is just in a little box. And I know that, just looking at your numbers, you assist many of our folks, okay? And all I can picture is if you had your own area somewhere else where you can do what you need to do and expand when the opportunity exists. Right now, you can't.
Right.
Not unless you buy somebody's property next door, which is not going to be profitable versus not profitable for them, but not for the government. So I was just curious.
So, thank you for asking that, Mr. Chair. I think the governor has alluded to a health, I forget what it's called, like a health village, campus, if you will. Campus is the right word. In Barragata. I know she's talking to the federal government. That's the old golfing range, Admiral's golfing range. So there is a possibility if the event that the governor's discussion, which indication has told me that it's very well received and positive. And so however that pans out, the idea is a total health campus where public health, GMH, and Guam Behavioral Health are all in the same area. So I think that's probably the administration's thinking of a huge relocation. But today we are at Tamuning Center, and yes,
Okay.
we serve a lot of people.
All right, okay. I'd like to also recognize colleagues that have joined us. We have Madam Speaker Tina Muñoz Barnes is here, Senator Sabina Perez, and Senator Luis Muñoz. I would now proceed, I would ask now the Oversight Chair if she has any questions, because you loaded us with a lot of data. Thank you.
Yes, they're hoping
Thank you,
no
Mr. Chair.
questions because your presentation was very thorough. But I want to thank you because you did answer a lot of, I had a list based on things that you had kind of promised that you were going to take care of this year, this fiscal year. And very happy that I was able to make check marks on a lot of those that you've completed. So thank you to all your team and for the work that you've done all year and your presentation today.
Thank you, Senator, and thank you for your support always.
The billing is a great progress for Guam, for all of us. So especially that, I want to congratulate you. I hope the CMS accreditation is smooth, or your work on that. Mm-hmm. Can you just be more precise as to these pending contracts with private insurance providers?
How does that work?
No, how soon do you think? Because
We're in the process right now.
do you think it might take within a
This
month,
month.
or you're taking longer
This
than
month.
a month? Okay,
Signed contracts,
Great.
agreements,
that's what I wanted to hear.
and CMS next month, application submission.
Great. And then So some of the COVID, your use of COVID funding you've talked about, and then you talked about grants applications that you submitted or will submit. One of them is telehealth. Can you just expand? If you don't get this
The one
grant,
that I talked to about
Yeah. If you don't get the grant, will you still be able to continue with telehealth services?
Yes, we will be able to because of the initial investment of the 500,000 grant. As I mentioned earlier, we are purchasing a professional Zoom software with all the HIPAA compliance, bells and whistles, and safeguards for our patients' records. And so, yes, we'll be able to continue telehealth, but just limited to Guam Behavioral Health. The whole idea of the telehealth grant that I mentioned that we're working in the application is to expand our reach and get into the mayor's offices so that many of our patients who have transportation problems can just go to their mayor's office at an appointment time, and we can speak to them from their mayor's office instead of try to take mass transportation or, their transportation issues to Tamuning. And so this is just our way of trying to better serve our clients and also forcing them to link to their mayor's office so that the mayors I know the mayors know who they are, but letting them know who the mayors are and just better coordinating a lot of the services that the government of Guam does at the village level.
All right, and I just wanted to ensure, because Medicare is supposed to be covering telehealth for mental health issues also, so I just want, you have that capability, that
Yes.
capacity, yes. What about part of the COVID funding you received was in addition to our, the money that the governor was able to...
173?
Right, that was 173, but then you said received the 500,000 for territories?
Yes,
So
that's the grant.
You list staffing, PPEs, isolation unit, and TGH, but the staffing part, what are you taking care of with that for staffing?
Are you talking about the 500,000?
I can't hear you, pardon? The 500,000 that the territories received, so you list the uses of that 500 as staffing, PPEs, isolation.
Yes.
What staffing is covered by that? Is that like overtime you're using or additional staffing?
Additional staffing for this, the funds for staffing is to continue to help. We use a lot of the funding to staff peer support to help with the crisis hotline. So that's funding that we don't have for the 24-hour crisis center. I needed to take the crisis hotline away. Believe it or not, the nurses in the units were answering the crisis hotline on top of taking care of the patients in the unit. It's not acceptable. It's the occupancy is too high. The patient in front of them is just as important as the patient that's making that crisis call. So we needed to put dedicated staff, and that dedicated staff, which are peer support, who have the training, we don't have the funding for that. And so we use the mental health COVID grant to pay for those.
Are those temporary hires? Are they going to be going away, or are you going to be able to keep them?
They are our current peer support, but not hired to do crisis work.
I see. Okay. All right. Yeah, and I want to thank you for the crisis work during the pandemic, and I know that you have been very responsive when any issues came through my office, and they want to know if they're able to seek services during this time. You were very responsive. So just a couple more questions. One is the DOC work.
Yes.
All right. I totally understand, and I agree with your strategy there. But when GMH did this, made an arrangement with DOC, and they ended up entering into like a contract with DOC, and they were going to get paid by DOC. And as we've seen in the paper, they didn't get paid sometimes, and they ended up not paying their withholding taxes, things like this. And I don't want to see this happen with behavioral health. You guys are on a, you're doing well. What is your arrangement, literally financial arrangement with
So,
DOC?
yeah, thank you, Senator, for that question. The details will be worked out. The executive order, we were just talking on a macro level about what needed to happen. The executive order gave us the authority. Now, I have meetings tomorrow and Wednesday with DOC front office to make sure we iron out those MOUs. So now we need to get into an MOU agreement with the Department of Corrections, and we're going to talk nuts and bolts about staffing and funding.
All right, do you have extra staff at where you are that's going to be able to go over to DOC, or are you
No,
looking at?
so DOC, the whole idea of DOC and one of the thought process, and we're going to iron that out and make sure that we're very clear on the expectation, is DOC has some positions in DOC because they do have a small staffing unit that is trying to do some services. We're trying to bring in full mental health services to DOC. And so the mindset is for those FTEs to remain, to come over or remain working in the mental health division. So they don't just have, they have positions. They actually have psych tech positions. They have a current psychologist funding there. Those will all be transferred, or I'm not sure what the right term is, but will be part of our efforts.
All right,
Right.
thank you.
There won't be a DOC and a behavioral health. Everything will be managed under DOC. That, at least, is the mindset we have today.
Oh.
And I believe, and we're all on the same page.
Okay, all right. When you work that out, if I could get a
Yes,
copy. Yeah,
definitely.
thanks.
And that, again, is going to be in part of the MOU.
All right, and then contracts. So your contractual services, what is your understanding? I thought it looks to me like you're requesting significantly lower than you expended in FY19 and FY20. Is that correct, under contracts, contractual services? Like $700,000 less than what you expended in FY19. Or am I
Service
reading this
contracts,
wrong?
correct?
Pardon?
The service contracts?
Contractual services, the whole category, total. Is, are you, when you say you were going to, those certain services did not belong with Guam Behavioral Health, are you moving the costs of those out also? How?
That's correct. Yeah. I mean, we're not going to keep that funding because we believe the funding and the program and the contract should go to DISIT.
All right. I don't remember during the DISIT hearing whether they talked about getting funding for those. What if, yeah, I'm worried now there might be a big gap.
Well, we're not going to need the funding when we move the appropriate contracts to them. We showed that reduction in our budget.
Right. So you're not going to get the funding. These programs will not be managed by Guam Behavioral Health.
Oh, what you're saying is they didn't add it into their
Correct.
budget.
That's what I'm worried about. We're going to have to check. But, okay. Is there any other contractual expense that has decreased or will be decreased in 2021?
Our rental, as I mentioned,
Say that
our
one more-
rentals,
Oh, your rental. Okay, great. That's good. All right, and then one last question. Were you able to access your prior year, what was it? Or to take care of your prior year obligations last year or during this fiscal year? I think you made a point of that last time. Right, did you pay your prior year obligations? That's exactly right. I think it was prior,
so
including
I think
overtime
you're talking.
from
You're
typhoons.
talking about the prior year typhoon,
Yes.
dolphin. I think that's what it was,
Yes.
like way back.
Yes.
Yes. So we're working that out, and we will be paying that before the end of the fiscal year.
Okay, it looks like overtime from 2014 and 2015. So you're still working that out?
Yes.
All right. Okay, Mr. Chair, thank you. Thank you again. Thank you.
Thank you, Senator.
Thank you.
Thank you very much.
Ms. Ariola, Therese,
Yes.
when we talk about wrapping up, okay, for all your prior obligation, make sure any personal action that needs to be taken care of is taken care of. Because I get calls from other agencies. They have increments, they got whatever. Let's close the loop, okay?
For prior year.
For any prior year, if you need to settle it, and if you can't settle it and you need it to be a budget act to be able to settle it, then please advise us. Please advise your oversight, advise me. So we make sure we put it in, because we can't have employees wondering what is it going to take to get them whole, okay? I would ask, Madam Speaker, do you have any questions, ma'am?
I do have a comment and a couple of questions based on a follow-up. Thank you, Mr. Chair, for giving me the opportunity. And first of all, I want to thank Therese and your whole Guam Behavioral Health Wellness Center, Undunkel and Jesus Masi, for all the work. I also want to say thank you for your presentation. This wasn't just a budget presentation, but a full encapsulation of what behavioral health does for the community as a whole. And I think a lot of agencies should emulate and detail the ways you guys have set this presentation today. A lot of the questions that I wanted to ask today, as it relates to the CARES Act funding and how it was being used during this time, you've answered. The crisis hotline, which is a great resource for our community, and the impact that has done to the community, and also the executive order as it relates to behavioral health annex at DOC and the resources there. I did want to note that under that executive order, sub-item number 2, it says sharing of resources and budget development in the current fiscal year. Behavioral health and DOC shall work within their budgetary constraints to advance to the best of their ability. So I know that those efforts are still being worked out. And as I see that you have been such an expert in applying for federal grants, that I usually ask every agency that comes in, I'm very impressed. And I want to see you continue to do that, because even as we here in the Speaker's office, we continue to hear what the federal government is giving to Guam on a weekly basis, what the programs are out there. There may be other grants that can be applied for as it relates to the services that you're doing. So if you can continue to do that, and you can call my office and we can give you the link to what the feds share with us on a weekly basis every Thursday morning at 3 in the morning. I also want to say that having had the opportunity to work with the different service contracts that you guys hold now, I just want to get a verification, because I know that the CAREDOT, the Community Habilitation Program, and then the Respite Care Program, those used to be under the direction of DICIT. How long did behavioral health have this now?
Since the federal management team took over, initially DICIT was part of the permanent injunction, and somehow it was pulled into Guam Behavioral Health, and I believe it was, the mindset was that Guam Behavioral Health and DICIT was going to be at one time merged, and so the federal management team decided to pull those contracts to Guam Behavioral Health, and there is a very stark difference between DICIT and the population they serve and what Guam Behavioral Health serves, which are serious mental illness and drug addiction.
So is there policy
So
legislation?
they pulled it in and it never went back.
Right.
So now that it just honestly does not make sense
Right.
being with us.
And I understand, but I think it's going to need policy legislation, am I right, to bring it back by statute? Because it was initiated through statute, if I'm not mistaken.
No, I believe it was just an executive order that moved those contracts to But we can look into it. I mean, whatever I need to make it happen, it's the appropriate thing to do. We need to, one thing that COVID, and it just reminds me, one thing that COVID really, really forced all of us to think about is what is our core mission? And focus on only delivering that, right? So that was one of the things, like, you know, these 3 contracts, they're so important. They have to continue.
Yes.
But they do not belong to Guam Behavioral Health. It doesn't belong here. It's more of a DISIT. DISIT takes care of intellectual disability and physical
Right.
disability. We
The
don't.
Department of Integrated Services for Individuals with Disabilities, and Mr. Chair, if I may, just because it's being said today, I think it's important that in policy, even if it cannot be done through executive order and policy is going to need it, then our office is open to work on that, working closely with the oversight chair, because when 18 or 20 years ago, it was under the jurisdiction of DISID, and that's the only reason why I asked. And if
I
you're
asked a
saying
big
through court
question.
order,
Why is this here? And
yeah.
really, no one could tell me other than FMT pulled it in.
And the other thing I want to note, Mr. Chair, too, the panel here is Undankluna Sidzus Masi for the CARF accreditation. I know that the extension to this December is great, but even more so that the work is already gone for the accreditation for 2021 and moving on, and being able to get us off and get the permanent injunction vacated in December of last year. It's music to my ears, and I know that it had to do with abiding with a lot of the assessments that the district court has laid on Guam for the many years, but more importantly, that you guys have literally stepped up to the plate to move these programs, to work with the concerns, to work with the mandates, and that I guess it was Judge Consuelo that made those changes back. So thank you so very much. So, Mr. Chair, if I may, I know based on the questions and the assessments, I think it's critical that at least we look at those services, and knowing that if you can continue to look for more grants, it will continue to help us even during this, especially during this time of critical need. And the assessments that you have been, the year is not even, it's just halfway there. And from last year, having to assess more than several thousand consumers, it's June and you're already over that time, over that assessment of taking care of these many more patients or more consumers. And I think that a job well done, and if there's anything I can do to help, please.
Thank you,
let
Madam
us know.
Speaker. I just wanted to talk a little bit on the point of federal dollars for when we get into the Department of Corrections. One thing that we have not done, of course, is tap on much federal dollars available that we will definitely be looking into. We're already looking into. Our federal partners have been alerted, and I'm on a very close communication text message with the Region 9 administrator for SAMHSA, who I immediately said, this is what's coming down the pipe. Please start sending us any linkages and funding sources of mental health, standing up mental health in correctional facilities. So there's completely separate funding for that. That, you know me, I'm very aggressive when it comes to funding money. We're definitely not going to, we're going to avail ourselves to everything available when it comes to federal funding that we can avail ourselves to for the Department of Corrections.
Mr. Chair, thank you. And I say again, I'm very impressed at the presentation. I'm very impressed at the numbers. And I want to say, to you and to your team for continuing to service and provide service to our community.
Thank you, Madam Speaker.
Thank you, Madam Speaker. And Therese,
Yes, sir.
if you ever plan on setting up a workshop
For grant writing?
for grants and for maybe inspiring other directors to go after grants, we would appreciate it. But you don't have to comment, Therese. Leave that alone. Senator Lee, do you have any
My background,
questions?
right?
Thank you.
And Declan, Sidus Masi, Mr. Chair, and thank you very much for the very thorough update, Madam Director. And I just want to echo your sentiments and give a huge shout out to the GBHWC team, especially for their dedication during this COVID emergency period. We've really seen the agency step up and really serve our people at their most critical time as this continues. So I want to thank you for that. I want to thank you for the update about the annex. So we've been seeing that in the news as well. All the questions that I have about that, you've already answered. One thing that I did want to have the opportunity to talk to you about is outreach. You mentioned federal grant funding, and some applications are still pending, some responses are still pending. Applications are pending responses and also pending submission. So we're keeping our fingers crossed. We're really praying that we can get good news on those. But can you please update the committee on outreach efforts for some of these services that GBHWC is offering and how we can maybe help on our end to get the word out about what other services are available? I know we've been hearing it in a lot of the governor's, like the JIC releases, but if there's anything else we can do to make sure that the people who need these services are aware of them.
Thank you, Senator, for that question. Absolutely. I would like every senator's office to link to Guam Behavioral Health's website, to link to Guam Behavioral Health's Facebook page. Go in, like it, share it. That's definitely one way of getting the information out directly. I mean, that's how we can, that's the help that we can, that you folks could provide for us. You have a very thorough presentation. Maybe some of these things you are aware of, and maybe now you're more informed of what the services we provide. When constituents come into your office, you know now who to call. I'm sorry, one of the things you should have on your phones, please put down the crisis number, 647-8833, 647-8833. Every senator, every public official, every policymaker should have that number ready to give anybody. So between knowing the crisis hotline, connecting and being our friend in Facebook, and just linking in that way and helping spread the awareness that Guam Behavioral Health is here to serve our people, that would be a tremendous help. Thank you
very
so much.
Has the department considered coordinating with the Guam Department of Labor to increase outreach efforts to those who might be experiencing especially employment and financial difficulties during this time?
Yes, one of the thought processes to hand out pamphlets as the application is going through, and that's definitely in the thought process. We're just looking at how we're going to reproduce our, the ability to reproduce our general information brochures and handing it out properly in those forums. But yes, it's been thought of, and we'll follow through on that.
Great. Can you please provide the committee with updates on GBHWC's youth mental health first aid training efforts? And I wanted to know specifically, has GBHWC coordinated with GDOE to meet the requirements of Public Law 35-40? And have these training efforts continued even under the pandemic conditions?
Yes, thank you, Senator, and thank you for your support, because that was your bill in providing support for mental health first aid for our youth. And so, yes, my deputy, Carissa Pangilinan, is leading that charge with a team of trainers. We work very closely with Guam Department of Education. We are training police officers, firefighters. We've had several, I'm sorry I don't have the numbers, several trainings prior to COVID hitting. Of course, when COVID hit, we stopped. We're trying to figure out now with everybody going back to work, the ability to do this without taking away from the COVID efforts. and doing it probably more sessions, less people. So in a room where there should have been maybe 30 or 15, we're going to have more groups, more training sessions. And that philosophy goes in line with even our groups in the department. We have to adjust group numbers. DNA, Drug and Alcohol Division, instead of having group once a week, Ms. Athena is going to have to do, she's already has plans to do multiple groups in a week, just to adhere to social distancing and the number of patients and clients that can be in one room.
Thank you very much for that update. And it's so good to hear that we're just trying to adjust the schedules to really meet the need, because we shouldn't be shying away from these challenges at this point in time when our community really needs it.
It's just a challenge.
Right, exactly.
That's all.
An opportunity, too, for us to
right.
continue to serve. So my last question, and thank you very much, Mr. Chair, for indulging me. On page 65 of your budget submission, could you please clarify how the additional $1.8 million will be used for operations? I think it's a link to the Healthy Futures Fund, or maybe just explain that for me, if you could.
I'm sorry, page?
65?
Sorry. My copy is not paged. What specifically?
So I was looking at the budget submission, and it looks like $1,897,836 will be used for Operations Healthy Futures Fund. And so I just wanted to know that chunk, is it a shift from last year? And then what would that be covering? Because you were mentioning there's,
Are you looking at the summary digest? I'm sorry, I'm trying to follow.
I think it was on page 65 of what was submitted to all of our offices. So I'm not sure if, but just in general, maybe, in terms of the Healthy Futures Fund segment of your budget, because you were mentioning that you receive federal grant funding, and a majority of that is 100% with no matches. So I just wanted to know specifically with the Healthy Futures Fund portion of the budget.
So
if you
Healthy
could-
Future Fund comprises of $24,159,000. Of that, the line item budget of $21 million is being requested. 1.640 for drug and alcohol service contracts with NGOs, and 800,000 for inpatient detox unit. Okay, thank you.
Sidos Masi. Thank you very much, Mr. Chair. And thanks again to you, to Ms. Carissa, everybody at GBHWC for really just doing an outstanding job. Thank you.
Thank you, Senator.
Thank you, Senator Lee. Senator Kelly Morris Tidno, and you'll be followed by Senator Torres.
Situs Masi, Mr. Chair, and thank you both for being here. As others have mentioned, it's a really thorough presentation, but it was a really important one to be walked through, I think, for us to understand all of those services and how we're really reaching out to the community. It's an amazing number of programs and an amount of work and services that 213 staff are doing on behalf of us all. And just a couple of comments before I move on to a couple of questions. I appreciated how you discussed the pharmacy. Many might think of medication as being negative, but you pointed out that it assures the health and well-being of the patients, and it means that the patients are engaging with the treatment,
That's right.
which my understanding has been, in various situations, that can actually be part of the most difficult part of treatment, is getting that engagement. And then for the annex to the Department of Corrections, I just want to highlight that it's such an important move. We keep on hearing from judges, marshals, the police, the public defender's office, and others that these kinds of methods have good success rates in making a difference and actually decreasing recidivism and making our community safer. Part of caring for the community is caring for the mental health and well-being of our people who they are, what their struggles are, and figuring out ways to treat and support them. I mean, I'd like to go on, but I'll move on to the questions. But the partnering with the mayors to reach them where they are, the telehealth counseling, these are such important moves. And I think with the telehealth, it's additionally important because we're seeing that long-term planning on the part of your department, that it's using COVID-19 funds to their fullest. It's thinking about the here and now and us dealing with this crisis, but it's also setting us up in really important ways to be providing those services to people in the long run, because that's my understanding from your presentation. It isn't meant for just here and now. It is meant for the long term. And as you mentioned, it really helps resolve a lot of issues. I've used it myself for doctor's appointments and saving a half hour out of my life to drive, well, actually it's more than that, to drive there, to sit there, and then to drive back. I mean, that time saved is really valuable, and it really helps those, like you said, who have those transportation issues and some other issues on top of that.
And Senator, one of the things that I did not mention to the body is telehealth. Also, you see a decrease in no-shows. So more people are keeping their appointments because it's easier for them to see their therapists or their doctors. And so those are real big data indicators that are very helpful in getting our community the healthcare, the mental health care they need. So between helping in the transportation issues they may have, or canceling appointments because they don't have babysitters, especially now with schools out and health daycares are not fully operational, the no-show rate has decreased tremendously. That's important to mention.
That's very good to hear. And again, moving forward, that's exactly what we want, is more people being able to actually be treated and be seen. If I could ask, in what ways is the telehealth working? Is it through, it sounded kind of like it's through desktop computers or laptops, maybe that might be stationed at the mayor's office, but for my doctor's office, I actually, I tried to do the laptop, but it became very complicated for a variety of reasons, and so they reached out to me through WhatsApp, which I thought was awesome. Can it be used through a program like that, readily available?
So telehealth are two parts. You can, and we need to adapt in whatever means that the patient or the consumer has the ability to. Most of the time, it's through laptops and Zoom capability, but telephonic is also approved by SAMHSA, and the relaxation of those regulations for telehealth and telephonic use for therapy is also the ability. So it could be phone call, and it could be video through laptops or desktops.
Sujus Masi for those additional details. So going back to the accreditation, does the accreditation that was issued in 2017, does it embrace all of the current programs and services that you're offering right now? I know we had some different discussions about these programs that are maybe more suited for DISID. Are those within?
They're not part of accreditation.
Okay, and are there others that are not?
The new stand-up ones like DOCs won't be, because we needed to apply and put that application and what programs will be accredited or resurveyed last year. So the DOC, the Guam Behavioral Health at DOC facility will not be part of the accreditation, but they'll definitely be the next accreditation in 3 years.
I see. And with the fee schedule, in looking at the fee schedule, it looks like it was approved last in 2012. Are there plans for updating that fee schedule?
Thank you for asking that. Yes, and we we are looking into a proposed fee schedule that will be presented to the body, hopefully by the end of the fiscal year, because prices have changed tremendously.
Gulf Malik. Yes, that's good to hear, because with the agencies, and again, I really commend you for finding those federal dollars. Every bit of federal funding that we can leverage for our community is so valuable. But also with our fee schedules, we have to have that balance of having some sustainability for the services that are provided, and along with the other considerations. So that's good to hear. Let's see. And you had already talked about that the work with the insurances and those providers is going to be finalized this month, so that's very good news. Now we get quite a few people that are new to Guam. Maybe they're assigned here temporarily, or perhaps they're military or dependents or civilians working for the military, something like that. Does the Guam Behavioral Health and Wellness Center accept stateside HMO subscribers? Is there any gap there?
Not at this point. We need to get our local providers on track first. And those are the part of the agreements that we're working out this month. And we're negotiating.
Okay, so you're saying...
filling out and signing between the insurance companies locally. I think we need to work on getting the local ones on board first, because our local community have those insurances, so we can bill them first. And then, of course, and then we can, anything is possible. And then after that, once we get all that done, then we can go for, you're talking like Blue Shield and other things like that. That's always possible, but very, in the future. I think it's important that we get our local insurance companies on board first.
Definitely step one, but it's good to know that you have step two in mind down the road when you can get there. And good to know that it's just going to be more and more available for those of us that are here.
Anything further, Senator Kelly?
Yes. With my last one, are there any off-island patients that you're currently servicing now, or? Yeah.
I'm sorry.
Are there any off-island patients that are, I guess, working with you? Is all your work here?
So we have five off-island consumers, 3 in a Texas facility and 2 in Florida.
And could you explain a little bit about how that works? I'm assuming that they started their treatment here.
Basically, they find the court orders. The court finds that Guam Behavioral Health doesn't have the facility or the skills to. These consumers need more intensive services that Guam does not require. Guam does not have today, and so they order them through the public guardian, through the residential treatment fund, through a court order to be placed in an off-island facility. They are our consumers. We have regular clinical meetings with them, long-distance meetings with them to see how their progress is going, but they're being served off-island because we don't have the services here. They are not part of our budget. They're part of the residential treatment fund and paid for by them.
So, Juice Masi, for providing that information, it helps us understand that reaches beyond what we may have here, but it's still possible and it's still able to be servicing our community. So, Juice Masi, Mr. Chair, and thank you,
Senator,
for your answers.
Thank you, Senator Kelly. Senator Torres, ma'am.
Thank you. Therese,
Hi, Senator.
what a
Thank you.
wonderful, wonderful presentation. And I think that the fact that you mentioned the vacation of the permanent injunction was significant, and also your inclusion now in the National Health Services Corps. Will this then translate, the fact that you don't have the permanent injunction anymore, plus being with this organization, does this translate into more opportunities for Guam then in terms of funding or other federal considerations that you can tap into?
We've never had any limitation, even with the permanent injunction. The permanent injunction was just a federal order that made sure that we got up to par and we were doing what we needed to do. And so we're able to, I don't know of the permanent injunction being a hindrance of receiving any federal funding in the past or in the future. It was never an issue in the application process of any of our grants that we've received thus far.
Okay, that's good to know.
Yeah.
Senator Marsh Taitano brought up the issue about your off-island consumers, and as you were doing your presentation and talking about Guma Pahung and the Hinanauta residential home program, does Guam have the potential to increase its expertise so that we can perhaps end that type of court order for off-island consumers? Can you just
Thank you for bringing that up. 5 consumers off-island costs the government of Guam quite a bit of money. And currently we don't have the capacity. These facilities in Florida and in Texas have the capacity because there are many more of those type of patients, and so private companies open facilities to serve them. So we don't have the capacity right now. It doesn't mean that we cannot get the training or the capacity to bring them home. But it's going to take different type of training and very committed investment in the type of training that these folks are receiving off-island that we currently don't have today. And so it's not a, it can happen. There's going to have to be a lot of, we're going to have to open, it will have to be government run, which means we're going to have the home. So a facility needs to be identified, and then the major training for each type of client. So these clients have all different type of issues and all different level of care and needs. And so it's not impossible. We can bring them home when we identify the home, when we identify the training and the staff to help them, because currently we don't have the staff or the training to bring them home. But it's definitely it's not far-fetched. It's a possibility.
Capacity then entails not only the expertise to train them, but also the facility that's specific to their safety, right? So it's a two-part. Okay. But I would imagine that you also share an interest in wanting to provide that level of care eventually in Guam, given the prevalence of mental health issues on Guam, and also the fact that it's inevitable that we will have clientele that requires that extreme mental health care. So I thought I'd bring that up because I was encouraged by the different homes that you've opened.
Definitely, it's something we want to do. We don't want our consumers to be away from home. That is a measure, an extreme measure, because we didn't have it. So most definitely, when we're able to and can identify a home and the proper services, and specifically the training to have the staff with those type of services, to be able to care for those clients who are being cared for at a different type of level in the States, is always the best case, is to bring them home. And so, again, it's going to take a lot of planning and specific training that we're going to need to make some serious investment in training and the pool set. So, unfortunately, the situation we have is the staff in this environment is very limited already. And so I had kind of mentioned that similar to how nurses, and when there was a shortage of nurses and a shortage of teachers, we need to somehow develop that excitement of getting into this mental health field so that so that more and more of our students can get into this field and help our own people who are going to be their family members. We're connected. So, thank you.
Thank you, Mr. Chair. Thank you, Therese, and
Thank
to your
you.
staff.
Thank you, Senator Mary. Senator Sabina Perez?
Thank you, Mr. Chair, and thank you, Therese, for all your hard work and such a great presentation, very thorough, and it really makes everything relatable in regards to how government funds are expended for much-needed services, and it's quite an array of services that you guys provide, and considering, you know, the need in the community. And I just want to thank everybody at Guam Behavioral Health for
you.
standing up during this COVID pandemic as well. So I don't have very many questions to add. I just would like to, if you can, you know, regards to staffing, I think, you know, from what I see in government is there's a need for additional staffing and also successional planning. What are your efforts in regards to ensuring that the staffing needs are met on a long-term basis, in addition to, I mean, you did mention, congratulations on getting the certification through NHSC, and that's a big improvement, and I know that's something that you had your eye on very early on, and it's I'm really happy to see the progress. But in terms of successional planning, I know that, you know, we need to support those that are supporting the community too as well. So if you can talk a little bit about that.
Well, with regards to staffing, I'm very aggressive. As I mentioned earlier, recruitment is aggressive. And I mean, I talk to our HR, DOA, and BBMR, if not on a weekly basis, daily basis. So we are all moving in the same speed when it comes to recruitment. And so I can only assure you that my efforts to ensure that all the staff that is funded and needs to be hired are hired. And it's the collaboration of our administration and and my relationship with the department directors that move things along. We got to work as a team, and we're working as a team to get these healthcare providers hired quickly. But at the same time, recruitment is slow because you have to go through the list and make sure, because everything is about fairness, right? So, you know, if this was a private organization, I could hire tomorrow just looking at a resume. But we're not, and the government requires us to ensure that many people who put in an application is given a fair chance. And so the rating system, there's just more added steps in the government rather than in the private sector. I mean, in the private sector, you can give me a resume and I can hire you tomorrow. It's different. So, but given those safeguards for transparency and fairness of hiring, I think we move pretty fast for a department. I hear I'm always talked about how I'm pushing, but pushing in a nice way.
Do you see any steps that need to be fixed, so to speak, as far as recruitment of additional staff?
You're asking what steps?
Yeah, if you can recommend any, I mean, my office is willing to work with you in regards to improving the system of recruitment.
Well, a big goal is for Guam Behavioral Health to be private. I mean, autonomous. That would be an easy fix. But, you know, we cannot be autonomous until we get our billing system fully full force, and we're just like in the infancy of our billing. So one of the reasons why, maybe GMH has an easier time recruiting is because they're an autonomous agency. We're not. We're a line agency. So, we should, and we need to adhere to those processes in hiring. But long-term wise, one of the ways that can help Guam Behavioral Health is that we're autonomous, but we're not ready to be autonomous. We're only ready to be autonomous when our billing system is full steam ahead, and we're not there yet. We are just in the infancy stage of collection.
The other question I have is in regards to outreach within the youth in prevention of, or at least treatment of drug use. Can you talk a little bit more about how that program works, and do you see any improvements and any growth in that area as far as drug prevention for the youth?
So we work very closely with Guam Department of Education, and so we are always doing outreaches through our prevention office with them, with nonprofit organizations, and businesses. Actually, it's not just nonprofit organizations, but other businesses. And so outreach is kind of like an everyday thing for us. It's not a specific program per se. So we're constantly talking to people about the services we provide at the department. Did I misunderstand your question?
No, you answered the question, but maybe perhaps digging a little deeper, considering there's an increase in drug use. I mean, are you aware of the recent survey about drug use in schools, and what is being done to address the issue?
So a lot of that has to do with our partnership with the Lieutenant Governor, Guam Department of Education, the safety task force, education safety task force that the Lieutenant Governor is spearheading. We sit in that task force, Guam Behavioral Health, GPD, DYA, the front office, and Guam DOE's counseling group, and it's a strategic approach to the issues that you've mentioned in the schools, and so we're there helping in the sense that we're connected, and we do training with Guam Department of Education's counselors to ensure that they have the proper counseling training when it comes to mental health first aid that you folks that funded us for.
The other question I had in regards to procurement. So with budget time, there's something called procurement planning, and this is something that's released by GSA. And so what they request from different agencies is a list of items that you guys are going to procure, services or supplies. So have you prepared a list for GSA so that way they can consolidate purchases and hopefully get better
Economies of scale. It's what you're
yes,
talking
exactly.
about, right? We haven't submitted that yet, but they normally do. They normally request us, and we'll get that to them when they request us.
Great.
But they haven't asked us yet. That's why it's not like on my mind. I thought it was a new thing, but Debbie here, my fiscal officer, just reminded me it's an annual request.
Okay, thank you. Just one last question. So in regards to training, procurement training, how many in your agency have fulfilled the procurement requirements for training that are involved in procurement?
All four who are in the fiscal department who should be trained are trained.
Okay, congratulations. Thank you. No further questions.
Thank you, Senator Perez. Senator Luis Muñoz.
Thank you, Senator.
Thank you, Chairman. Thank you. Thank you, Director Arreola.
Thank you.
And your staff again. I know you and I have kind of collaborated on a few things together. I take special interest, like I tell all the agencies, with the Healthy Futures Fund, and because Guam Behavioral Health and Wellness is taking more than 50% of it, of course, there's a lot of, I kind of look into all of the specifics that behavioral health has to offer the community. I noticed that you had over maybe 1.8 million requests for fiscal year 2021, and about 750,000 of it is going to the director's office. Can you just specify, is that for more staff in the director's office?
Are you talking about director's office staff
Well, yeah, I'm noticing in the...
or budget?
Yeah, I'm just noticing in the budget that there's about 746,318 that was requested, and it shows that's...
That's for recruitment of personnel and capital outlay.
Okay.
And that's outlined in the budget digest. the
Okay, I was
specifics.
wondering if, is any of that, could any of that be specific for a grant writer? And I'm wondering if that could be like a benefit to the agency to actually have a full-time employee grant writer on your staff. Is that something that can be done?
I have to look into that, but that's already, specifically laid out for
Okay.
things.
Because you mentioned that, a lot of your managers do that. They step away from what they're actually supposed to do and write grants. And I'm just wondering if, maybe that position, a full-time employee grant writer, would be very beneficial to the
Honestly
agency.
speaking, it would be one of my managers.
Oh, okay.
Because, there isn't a, how do I say it? I'm a grant manager. I've been doing grant writing for the last, 10, 13 years. There isn't a function, a title or a position in the government of Guam called grant writing. There isn't a class you can take or a degree you can get to grant writing. Grant writing is a lot of getting to know the population you serve and
Basically
being
through
very
experience.
very engrossed in your department. And so if I was to create a position called grant writer for Guam Behavioral Health, there wouldn't be a pool of people to apply for it that I would be even remotely interested in hiring other than the people who are already working in the department.
Like your managers.
Because it's really about getting to know the population you serve and the department that you work in. And so the reason why I highlighted that there is no grant staff per se, that's, I can say, okay, go after all the grants you can see and apply for it, is because the best people to do it are the people within the department, within the organization.
Okay. Thank you for helping me understand that. Thank you.
Thank you for that question.
So you mentioned you have vacant positions, and those are all already budgeted, right?
Correct.
Vacant positions. Okay. Of the 222 new clients from the COVID. When you say new clients, I mean, are those people
means
just picking up the phone and
No. So 22 new clients means they have come into our department rather through the crisis center or crisis call or walk-in, because we've been open. Remember, we've never closed.
Okay.
But we've just had very modified restrictions in coming into the building. And so 222 of those mean that they needed extensive. In other words, if they just called the crisis hotline, that's why the hotline number is much higher than you notice it's 1,000 some for the crisis hotline number, and yet I've identified 222 as COVID period new consumers, new patients. And that's because when calls come into the crisis hotline, they could be handled at that level. somebody just needed to talk to, suicide ideation was dropped down to a safe level, a plan was put in place. But there are people who call and say, for example, depression, anxiety, and it's not enough that initial call. I would like to see somebody regularly. Then we take an intake, we take an assessment. The minute we take an intake, we're intaking them as a new client. And so that's that number. 222 of the 1,000 some became new clients from COVID.
Okay.
1,000 some calls.
And do you still see like an accumulation to that number, even up to this day?
Yes, it's not, we're busy.
More
We
now.
are so busy. More and more, and it's a two-edged sword in the sense. We are very, very busy, and my staff is learning to multitask and be very flexible, and they're doing a great job at it. But it is a rise in volume of work, but at the same time, it's a compliment, because that means the stigma of seeking help has dropped tremendously, because people are no longer ashamed of coming in
Right.
and getting the help they need. So we have been inundated with walk-ins, with calls, people who want more regular treatment, regular therapy, regular counseling. And that's okay, because that's what we're here to do. We're here to serve. And we're here to help people. But it is, even though with a greater volume, it's a good sign. It's a good sign because people are getting the help they need.
I just wanted to understand the distinction between what is a normal call, a hotline call, and how does it relate to COVID, basically?
Well, a crisis call could be,
Any?
it depends on the person. So my crisis at the moment could be, I need to talk to somebody now. I'm not feeling good. I'm alone. I'm lonely. I'm in isolation. That could be a call. But it's various calls because it depends on the person who's calling in. It could be somebody who's actually thinking of taking their life and actually being a suicide call. So it really varies. It could be just somebody who, I've been lonely, I need to talk to somebody, I'm worried, I'm anxious, and it could be handled at that level because we have professional level people on the other side of the line. Or it could be more extensive, depression, needing to talk to somebody on a regular basis. We take them in. We always give every caller the option. Are you satisfied? You can always call us back. Would you like to see and talk to somebody more extensively? The minute they say yes, we take them in as an intake and a new patient.
Thank you for that. That's a great segue because we've met a couple times in regards to suicide prevention, and I still have a group of people who are still interested in assisting Guam Behavioral Health. So, I still would like to continue that conversation beyond this. Thank you. Thank you for that.
Always open. Thank you.
Thank you. And then I guess finally, you also mentioned that there were applications submitted pending awards. I think I calculated to be over 12 million. Does that mean that those applications are already approved and that's money coming in already, or is it just
Are you
still
talking about
hopeful?
submission and waiting award?
Yes,
Waiting to hear from them.
waiting to. So it hasn't really been approved then.
No.
Okay.
Waiting to. We submitted applications, but we haven't heard from them, and so we're constantly keeping track.
Okay.
Go on grants.gov and we could see the status.
Because that's
a
over
lot of
12
it
million, that's
slowed
a lot.
down because of
Yeah.
COVID.
Okay.
The federal government too had process, right, of review, and so those things slowed down. So I'm not too concerned. I think we have a pretty good track record in our application and process and writing grants, and so the stars are on our side. It's just a matter of hearing from them and how much is available when it comes to funding and at the time when they fund. Very often they fund us but at a lower level, but only because it's, they're funding other things. And it's like availability of funding. But then the next year, the funding levels vary.
Okay.
So I think we have a very good chance.
Okay.
We
I'm
have,
happy to know also that you're increasing your billing to include, Medicaid and Medicare and then all the insurance
And all the
companies.
insurance companies.
Every opportunity we can to assist Guam Behavioral Health definitely is a great opportunity. And that's my final question, Mr. Chair. But I just want to thank you, Director. I think the agency is definitely in a good position to have you in there. You're a get it done kind of director, and I'm sure that all the money that's appropriated from the Healthy Futures Fund is going into a great agency. So thank you very
Thank
much.
you, Senator. We're all here to help, and that's what I'm here to do.
Thank you, Senator Luis. Senator Sabina, you have a follow-up question on the budget?
Yes, thank you, Mr. Chair. So, Therese, I just have a question. You did a really good job of presenting all the services you provide to the community. I just was wondering, what are some of the gaps that you see, considering, the issue of ICE in our community has a huge impact? And I noticed that you have a 16-bed capacity for the detox inpatient unit. Do you see any gaps that needed to be addressed that are not encompassed in this budget?
I think on the mental health side, we have all the main pillars in place, our contracts with again, expanding the number of beds with the administration. This administration is very key in doing. And that's why, as I mentioned, we're already in the discussion of looking at taking over the possibility of the cottage homes. And so we have the basic components in place. We just need to expand it. But in speaking of expansion, the gap is truly, if you want to talk about gaps, truly the need for more substance abuse counselors. I can't stress that enough. And that's why I keep bringing up the fact, how do we get, similar to when Guam had a shortage, or the nation had a shortage of nurses and teachers, how do we get people interested, our young folks interested in getting into this arena? And so not just counselors, we have limited counselors, psychiatrists, psychologists, but substance abuse counselors. 3 years ago, we needed 72 on our island. We only had 24. 3 years ago. We, through our partnership, through the Guam Behavioral Health partnership with the Pacific Behavioral Health Coordinating Council, which are my counterparts all over the Pacific, and our partnership with SAMHSA and getting grants in that avenue, we're looking at development of a core training program to build that capacity. So the capacity is not really, have we not, like infrastructure-wise, the capacity is infrastructure-wise in the sense that we need more people to get more excited and get involved in this arena so that we can hire them. That's another issue about recruitment. We can have all the recruitment announcements out there, but nobody is applying. And I hate, and it's very often you see them leaving a nonprofit to come to the government or leaving the government to go to a nonprofit. We're all sharing the same people. It's not unusual for people to be working for the government full-time and doing part-time work, for example, at Sanctuary, or doing part-time work at Salvation Army, because there's a shortage of substance abuse counselors. So we need to think about that. How do we spur that excitement in our young kids to get into this arena?
Thank you so much, Therese.
All right, thank you. This concludes the committee, the budget hearing on the Guam Behavioral and Health and Wellness Center. The committee will continue to receive testimonies. Please address your written testimony to the Committee on General Government Operations, Appropriations, and Housing, and submit it via email to Senator Joe S. Agustin at gmail.com. Jesús Marcy for your attendance today, Ms. Ariola and your staff.
Thank you, Mr. Chair.
And for my colleagues, and for those at home, thank you for watching. The budget hearing on Bill 282-35 relative to the Guam Behavioral Health and Wellness Center is now adjourned. It is now 12 o'clock noon. Thank you.
Thank
Have a
you,
nice day.
Senators. Thank you.